is Dr. Ofoegbu, clinical coordinator for the Isaluhospitals Hospital. I'm practicing for over 10 years now. There are a lot of differences between, as in some years ago and now. Of course, the health-seeking behavior has changed drastically. People are more aware now, especially when it comes to social media influence about their health. A lot of people are more aware of their rights and their privileges as patients, or so it has influenced health-seeking behavior. People now, they challenge diagnosis, they challenge medications that they give them. They read up, they Google everything, they go online and search. So that affects the way, it also helps to improve the practice. So doctors also expect that, and doctors repeat themselves. It's not like before where you can just tell any patient whatever you want to tell the patient. Now you need to know your onions before you attend to a patient. So that's one of the biggest changes right now. The economy is getting worse and worse over time. So because of that, people are not able to afford quality health care, even when the quality health care is available. You understand? People are not able to pay for medications. They are not able to pay for procedures. They are not able to afford some investigations. So a lot of them are quite out of range of what the average person can afford. And I think that's where the health insurance comes in. But even at that, the health insurance has a lot of challenges too in Nigeria. So it has affected people. Of course, the economy has affected how people source for health. In some way, yes, it has. Because doctors right now, most people don't. The joy of being a doctor is when you treat someone and the person gets better, and you can look at the person and the person gets better, and you can look at the person, or you're fine, the person is better. That's mainly the joy of being a doctor, the person that was sick previously. But now you find out that people, because they can't afford probably they can't afford procedures or maybe surgeries, and so your hands are tied. This is good for this person. This person cannot afford it. You tend to now do things that will maybe go the route of, probably, how do I put it, alternatives that are not as good as the main solution, so that people will be able to afford your treatment. And at the end of the day, behind, as in the back of your mind, you know that this person is not getting the best because the person cannot afford it. So that's just it. Well, one of the solutions that you can probably, that people, that a company like yours that deal in diagnostic or equipments that are quite expensive, is to, as much as possible, in partnership with hospitals, probably you need to give them some form of leeway, as in when you give them the equipment, they don't need to pay at once. They pay gradually, and as they are paying this, they also charging the patients, so they'll be able to pay you back, and in doing so, you understand, they'll be able to afford to pay for such equipment. So,